You, the viewer, have asked the questions, and our resident veterinarian, Dr. Sally Foote, is ready to answer. Coming up on this episode of the Paw Report, we address a very important problem facing pet owners, and that is pet stress. We'll have all the answers for you coming up on this edition of the Paw Report, so stay with us.
Dave's Decorating Center is a proud supporter of the Paw Report on WEIU. Dave's Decorating Center features the Mohawk Smart Strand Silk Forever Clean Carpet. Dave's Decorating Center, authorized Mohawk Color Center in Charleston.
Okaw Vet Clinic in Tuscola and Dr. Sally Foote remind you to properly take care of your pets and are happy to help support the Paw Report on WEIU. Okaw Vet Clinic, located at 140 West Sales Street in downtown Tuscola. More information available at okawvetclinic.com.
Thanks for joining us for this episode of the Paw Report. I am your host, Kelly Runyon, and we have a familiar face or faces joining us again on this episode of the Paw Report. Our special buddies, Dr. Sally Foote and her buddy Ranger. And you two are pet partners. I guess I didn't, I've known you for several years and we've talked on this show several times, so I guess I didn't know that you two were pet partners. What exactly is that, Dr. Foote?
Pet Partners is the official organization that a person, with their dog or cat, and I believe there are also maybe some bunny rabbits, as part of, for pet-assisted therapy for, people say, like myself, I go to hospitals or nursing homes to visit with Ranger, where Ranger then is, the pet who might give comfort, or a way to interact. And so this is an organization, used to be called the Delta Society. And the Delta Society was first formed up, I don't know, maybe like 30 years ago, and it changed its name to Pet Partners. And so this organization then, I had to go through like 9 chapters, a 9, module training program online that I would be knowledgeable about interacting with hygiene and things like this, like going into a hospital, like going into a cancer ward, or a home, say for the developmentally disabled. And that I also knew about basic, like how to read my animal's body language to see if they're getting a little stressed by this visit, and pass all those, modules. And then Ranger and I together were certified. What that meant is it was a day, and they had this person certifying dogs, and they said, wow, this will be interesting. We've never certified a cat before. And
Ranger's sort of like a dog.
I said, yeah. I said, no, I think he'll make a great, kitty pet partner. So they do the same things, meaning they had where, instead of, say, a dog, you might just have, say, sit as you greet somebody. I had to hold Ranger while you walk and shake my hand or greet me, and he's to not get nervous, try to jump out of my arms. That's because he's got to be very good in these noisy situations. They would have people going by with wheelchairs and walkers, and 2 people purposely coming together and arguing. And how would he, would he stay calm? Would he be good? And then having people pet him and touch him and pick him up, would he stay calm? Would he be good? And so he was certified all the way up to the most challenging and highly stimulating environments.
Oh.
And and so that's what it's about. It's a great program. If anyone is interested in doing, having a therapy pet or doing this type of thing, I strongly recommend they go through a program like this, because while your pet might be really great and friendly with you at home, doesn't necessarily mean they're going to be that way like at a nursing home where you have all those buzzers and alarms going off. And then secondly, you do need to be knowledgeable about things like washing your hands before and after you visit with a person to prevent transfer of any kind of human disease. It's more about what's going on, human to human in that environment than what your pet might bring to them. And just stuff like that,
You mentioned early on in your answer about bringing comfort to others, and that's why you were part of the PET program. This is where we're going to kind of shift our episode and talk about comfort in the form of, well, it starts with stress. I mean, when an animal has to go to a vet, it's a lot of stress for the pet owner. It's a lot of stress for the pet, and we want to bring comfort to them when they have that process.
Yes.
Ironically enough, we're devoting a whole episode on stress in reptiles when somebody with reptiles has to go to the vet.
Right.
But let's shift to cats and dogs. And you said that it can be very stressful for the pet owner and the pet.
Yeah. Because, all right, even when I have to go to the doctor,
it's stressful.
There's stress. Even if I'm healthy and fine, there's still, what might they find, right? So there's an element of stress. And so for our pets, even if they're happy, there's some bit of element in there. Now then, I can't meow at him. You know what I'm saying? We're not talking the same language, but I have to do my best to understand when he's showing me that either something hurts or something he wants to avoid something, that I respect that, yet I might still have to feel his abdomen or feel a sore part of his body. So how I do that, it's best if I am mindful of literally how I touch his body, or with my assistant, or we provide things like a towel on the table and things just to make it more comfortable, to keep his stress as low as possible. Because if we don't do that, then what he learns is, wow, this is horrible, or he cries, or he struggles, because it's scary, loud noises are going on, if the big dog is barking. Then the next time when he might need to come in, he won't get in the carrier, he's hiding under the bed, he's struggling, and the client's like, oh my God, and the client may get bitten, and the client's like, oh my God, this is so hard. And so actually there was a study done by the Bayer Corporation with a major accounting firm for the American Veterinary Medical Association in 2011. And it was called the Veterinary Usage Study. And one of the leading factors that prevents people from bringing their pet to the veterinarian is the stress on the owner. The owner is so stressed, they're like, I don't want to do this. I'm not going to do it unless I absolutely have to. So then the pet may be sicker before they're brought in for care. And then you have, it's the client stress, and that's a whole nother thing.
Sure. And what happens if you have multiple pets?
Exactly.
I mean, that's an even, because a lot of people have more than one cat, more than one dog. They go in for preventative all at one time. How can a person, let's start at home.
Okay.
How can a person ease the stressors? An animal may just get used to traveling, and the only travel they get is to the vet's office.
Bingo. You're right. That's very common, that the only time your cat goes in the car, the only time your cat's in the carrier is to go to the veterinarian. And what was the experience like at that veterinarian? And that's what they remember about the whole thing. So the next time, it's hard to get him in the carrier. And stress is additive. So let's say your cat's like, oh, okay, and he's like this, and you shove him in the carrier, and he's sitting in the back going, oh, I hated that. Now you put him in the car. So he's already at this level of being stressed. Now you put him in the car, boom, the engine goes on. He's like, oh. And you're driving down the road, and there's semis passing you on 57 or whatever. And now he's getting more agitated. And then he comes into the waiting room where there's a dog barking, the telephone's ringing, people are going back and forth, and movement and noise, are very alerting to the cat. So now his anxiety just is continuing to rise. So travel to the veterinarian is the first step to help make it easier for your pet to come to the vet. So how do you do that? Well, we're going to keep the carrier out in the living room or the family room. And guess what gets tossed in and out of the carrier? And occasionally we shut the door and we make games out of it, like tuna or the most favorite treats. And then sometimes we're going to put him in the carrier, we're going to put him in the car and drive around the block and come home. So every time he goes in the car, it's not just about going to the vet and getting in the carriers, because if he's less anxious at that point, then he'll be less anxious overall at the vet. Same thing with your dog. If your dog only gets in the car primarily to go to the veterinarian, or maybe to be boarded perhaps, and they're nervous about boarding, again, the car ride gets them already stressed out. So taking them on short car rides where someone's tossing them treats in the back seat, giving them a food puzzle. If they won't eat the food, then you can use tools or products like the calming pheromone spray, or there might be a supplement, or talk to your veterinarian, because it's just for that day.
Right.
We might want to give them a medication to decrease that fear and anxiety, because overall it's going to be better for them, and that.
What about in the vet's office? I mean, I've had pets all my life, and like you said, when you get to the vet's office, it can be very loud, noisy, dogs, cats, other animals running around, and your dog is really stressed in there. And sometimes you do have to wait. It's just the nature of going to the office. I mean, humans have to wait when you go to the doctor. So what are some things we can do in your office?
Well, so I encourage clients to take some power, if you will, or things in their own hands to help their pet out, there aren't going to be many practices who get upset that say, for example, you know, you've come for your appointment, you can see there's 2 other people in the waiting room, the doctor had an emergency come in, so they're behind a little bit, and the phone's ringing off the hook, and you say, and your pet's shivering because, you know, this is they're going to have to wait, it's a noisy scene in a different place, and you say to the receptionist, tell you what, I'm just going to walk with Fluffy outside, and when you're ready for me, you can just wave at the door and I'll walk in.
Good.
You know, or you got my cell phone number? Yeah, why don't you just text me? I'm going to walk outside, or I'll sit in the car with the air conditioning on. It'll be easier for him, and you can just text me when you're ready for me to come in. Okay? Same thing with your cat. If it's real busy and they cannot get you and your cat in the other room, you could bring a towel and throw it over the cat's carrier. For the cats to not see what's going on helps them tremendously. Or again, you could say, I'll be in my car, just text me on my cell phone when you're ready for me to actually come in, listening to the radio or balancing my checkbook or whatever the heck you want to do. But you can take the lead that way. Granted, practices are learning these techniques. This is more like the leading edge, you know, change happening in veterinary medicine. My practice is low stress handling certified. It's a program for veterinarians, veterinary clinics to take to be trained in these techniques as well as specific handling techniques to make it nice to go to the vet and that. And so we are very proactive in this. You know, if we saw your pet shivering, they'd immediately be getting adapted. We'd get you in an exam room, or we'd say, why don't you go wait outside? We'll wait. We would be the one to tell you we'll do this for you. And there's a directory for that. There's also another program called the Fear Free program that's a little more general-based, introductory, but all the same. The staff should be a little more onto, you know how to help with your pet and stress. But by and large, if a client can see my pet's getting upset and you take steps like I'm going to go in the other corner of the waiting area, or you just say, I'll just be outside, most practices value and appreciate that because they know you're doing something to help decrease how upset their pet is, and they may not have thought of it because they're not so educated in it, but in the end they can see how it helps your pet, and they're usually going to say thank you for it. A second thing you can do is bring super, super, super yummy treats. Cut up in small pieces the size of a Cheerio. And you can offer that to the pet in the waiting room or offer it to them in the exam room. You can double check with the vet if it's okay. Sometimes if we're needing to do blood work or something, we may not want them fed. But most of the times, for most exams, giving them a reward is what then translates to the pet that, oh, hey, it's all right, come in here now.
I'd like for you to kind of delve in a little deeper about how your office is a stress-free environment. You touched on it, but you said it's your entire staff and it was training that had to be done. And really it's something that as a pet owner, you may want to seek out when you're looking for a vet to treat your animal. Can you tell us more about why you made the investment to do that sort of training and why it was important for your office to do that?
Yes, so low stress handling, it's a term, and actually it's a trademark term, was formed by Dr. Sophia Yin. She was a veterinarian and behaviorist and a friend of mine. And in myself and my own personal interest professionally, I always, knew and liked behavior. And I did not like what I'll call the traditional handling techniques, meaning like 2 people holding on a dog and grabbing on them tight, and somebody grabbing the cat by the back of the neck. And many places, many of the technical schools still teach along that way, and the veterinary schools, yet I just didn't feel that was right. And luckily I worked at a practice in my youth that the boss was like, no, let's just hold them in a nicer way. They get upset. So that was a little intuitive. But Sophia wrote the textbook then, the Low Stress Handling Restraint and Behavior Modification textbook in 2009. And I purchased the textbook, and along with another veterinarian, decided I'm going to have all my staff, we're all going to do this, okay? And while they would do some things, and then it became much more like sort of structured following things in the textbook. And then Sophia launched the certification program where she took the textbook, expanded it into 20 modules for online learning that are instructional. You actually learn how to wrap the towel around the cat so that they hold still and you're not grabbing their body or covering from the head, because a lot of cats like to be covered, or how to lead the dog, how to hold the dog in ways, how to position them for x-ray. and things that they're not struggling at, and especially really understanding how to read the body language of the animal in front of you, to know when they're getting upset before they get aggressive, before they get really upset, so you can change your approach, or examine them on the floor instead of the table, for example, if they're more calm there. Make that decision, and feel confident in it. So my staff and I all went through that program in 2014 and became certified. We were one of the first clinics to be certified. The program is still ongoing. Many veterinarians and veterinary clinics and shelters are becoming certified. They have a directory online. It's called, the website is called drsophiayin.com, or you can even just look up under low stress handling, will take you there. So you can find a clinic or find an individual who works at a clinic who is certified, and that would be a good way for you to know that you're going to a place, because it's now all the receptionists, the handling staff, the doctor, et cetera, has to be involved in doing this, and they understand, getting the animal away, reducing chaos in the waiting room, as I say when I speak. When you get in the exam area, immediately rewarding them or looking out for what gets them nervous and eliminate it and things like that.
Stress can cause a lot of problems, health problems in animals. I had a pet one time, and I don't know if it was technically right or not, but I think stress brought on some eye problems, some cataracts. I mean, it was an older dog, but can you talk about the various, they pant a lot, they breathe a lot, they shake a lot, and that can spawn some things.
Sure. So you have like immediate stress, the term would be called acute stress, meaning in this moment right now, I'm really scared, I'm really stressed out, oh my gosh. And that's a problem in itself. And then there could be chronic. Like every day, oh my gosh, the grandkids here for the next 3 months all over summer, and I'm pacing and I'm panting. So what happens in stress, the body responds. First of all, stress can be a little bit good, but it's basically there's something making life a little hard for you right now, and either you're going to just get used to it, or it's kind of threatening enough that you say, I want to try to get away from it and escape from it. So you may keep walking around to avoid or hide, or I feel stuck and I can't get away from it, so I am going to shiver and I don't know what to do, or maybe even go up into a state of panic, like you really try to. And that's where you see a lot of the heavy panting, digging, cats meowing, jumping literally out of things, etc. Or you may say, I'm going to tell you to get away. I'm going to get aggressive on you. Okay, so what's happening inside the body when all those mind decisions are being made is the cortisone in the body made by the adrenal gland goes skyrockets, straight up. And when that goes up, blood sugar goes up. If you've got a scared cat in the vet clinic, within a half an hour, his normal blood sugar, say 120, could show up as 250. Well, do I have a diabetic, or do I have a scared cat? A stressed cat. It may be just a stressed cat, but it makes it hard to diagnose that.
Sure.
Secondly, if I've got a little borderline heart problems, like early heart failure, a heart murmur, normally when they're sleeping on the couch at home, when they're sitting there shivering, like a dog shivering sitting next to you in a waiting room, his heart rate is now at like 150 to 160 beats per minute. That's pretty darn fast, and a cat's is over 200. And so if you think of that, beating like that for like a whole hour or two between travel, being there, going home, etc., before they calm down, that can be very damaging. And so then that's the acute problem, right? Then if it's like something chronic in the home every day, that's going unrecognized or untreated, say like the dog is nervous about the grandchild, or it's bad thunderstorm season. 2 or 3 days of this chronically anxious pet whose, say, heart rate is hanging at 160 beats every day, then maybe the dog we see 2 days later in heart failure. Right. Because how it was wearing down on their body. Stress is significant. And yes, we then may see other problems like hair loss, vomiting and diarrhea. That's a big one. Or like the cataract acceleration, different things like that.
Have you any particular cases come to mind where maybe you've seen somebody in your office and literally it was all about stress?
Yes, I have. It's a lot better now than it was before we were low stress handling certified. But yes, I have, and I'll just say this is again back early in my career, because they didn't teach us any about this in vet school, and unfortunately, it's still not a part of the curriculum, making this connection between the mind and the body. But that's what people like me do when I go out and I speak to other veterinarians and technicians. Going back though, About 30 years, as I said earlier
Oh,
in my
don't
career.
date yourself, Dr. Foote.
I didn't earn this for nothing. So there was an elderly cat, that came in. She was thin. She had lost a lot of weight, suspicious of hyperthyroidism. She hadn't been to the veterinarian in 15 years. She's not feeling good. We have to draw blood on her. And as they were holding her to draw her blood, and again, it was kind of like traditional handling, two people holding her down. She starts screaming. And then all of a sudden, she passes out. And she can't breathe. She went into laryngeal spasm because she was like, her heart rate was so high and she was, so
Stressed
upset.
out.
Well, so then here I am yelling at her, get your hands off the cat. And what they did, they thought it was nuts to say, let go of the cat. No, let go of the cat. And I'm doing resuscitation on the cat and we got her back. I just put her in the cage and said, we're not doing blood work today. No, we can't, And that really impressed me how struggle, stress, anxiety, or even aggression can cause them physical harm. And it can happen right in that moment, and it needs to be, addressed and borne in mind.
Right. As we wrap up here, let's again emphasize to pet owners most important things that they should do to make sure that their pet has for them to have a stress-free trip, for their pet to have a stress-free trip to the vet, and future trips to the vet.
I think the very first thing is to know what you're seeing, to recognize what is stress in a pet. What do they look like? There are two handouts on the Dr. Sophia Yin page. You might have to search a little bit for it. Or if people want to email me through Okaw Vet Clinic and I can send them a link, fine. Anyway, to be able to tell when the dog is first like looking around, panting like this, their ears maybe back a little bit, that's like low stress, but we want to recognize that then and help them either toss them treats, have a good experience, put the calming pheromone on then, because that's like that level that escalates up so quickly. And same thing for the cat too. We have a handout to show that for the cat. So recognize it early and then think, ooh, what's going on around here? We've got a dog barking in the face of my cat. Get the dog away. Oh, the cat's calmed down, looks good. Dog's barking in my cat's face, get them stressed. We want to avoid this. So avoidance of things that stress can be a big help, but you need to recognize what's happening when they're stressed to know that's what it is or likely is. We call these triggers. So avoidance of triggers is a big thing that can help, Then the second level is, can you give them something good to happen while something you may not be able to avoid, that's a trigger, so they change their mind about what it means. So that's the thing about tossing chicken in your cat carrier, because to them the carrier as a trigger is like, ugh, bad thing. Now it's like, oh, carrier has chicken in it. It's a good thing. Because you need to keep the cat in some kind of containment driving to the vet clinic, because you don't want them jumping out of your arms if something, scares them at the vet clinic. I won't go over the sadness of one day at work on that one I had. So they need to be in some kind of a carrier confinement, but we got to make it happy for them. Okay, right now they don't like it, so that's called counter conditioning. So that's when you do the counter conditioning.
And I think it has to be, a pet owner has to be programmed to make that investment to train. Because if not, then they're going to have that experience every time they go. Do you have these conversations with clients?
Oh, yes, all the time.
That's probably hard for you.
Yes, it's an added point of education in the exam room. And it's also something, I think in humans, in human medicine especially, there's this like separation of, behavior and psychology is not the same as like your physical health. It's just, and also too, when it's fear, when say a child looks a little scared or a child looks a bit fearful, most of us are like, oh, come on, get over it. Just knock it off. Come on, let's go. And so they tend to deal the same way with their pets. Now, say if a child really throws down into a huge temper tantrum or melts down in tears, or starts biting, then you realize, woo, we got a big problem. Likewise in the pet. This dog now who's normally happy and great, and when you're trying to drag him in the vet office now starts growling at you or jumps up and bites the leash, that's when like, whoa, we got a problem. But the thing is, the problem was way earlier, and we don't want him to be this bad. We don't want him to become the bad dog by actually biting somebody, or to have to get that upset before we go, aha, we have a problem. So I have those charts that I mentioned, those body language charts hang up in my exam room. And I'll just stand there and go, that's what your pet's doing.
Yeah.
See that? Oh, yeah. He's upset right now. We want to help them be less. And then say we put the Adaptil or the Feel Away on them or do the low stress handling, and we could see the pet relax. We'd point it out. We say, see, he's not pacing now. Isn't that good? Oh yeah, you know. So, and then we send those handouts home. So I'm very proactive on this. But yeah, it does take that, and it does take an investment. So like I say to my staff, look, not everybody's going to get them happy about the travel part, but as soon as those paws hit our threshold, if they can have a good experience or the best experience possible in here, that's what we have control over. That is what we do. We don't cut that out for anybody. We don't make it short on the easy ones. The easy ones get just as much of this, you know, low stress handling and pampering as the ones that are having a harder time, because those ones who find it easy to come in, it's kind of our insurance policy that's always going to be easy for them.
Yeah.
You know. So.
Excellent.
I'll get off my soapbox.
Oh, I know. You're awesome, Dr. Foote. And we appreciate you joining us today. And Ranger's just chill.
Oh, he is.
You know, he's a TV star.
Yes.
But we thank you both. We thank you that Ranger is stress-free today. And hopefully somebody out there watching will take home what you've said and change their ways and start some training before they head to the vet's office again.
Well, thank you. And if they have any questions, they can go to our website.
Yeah, absolutely. Well, thanks again. Thanks, Ranger. And of course, thank all of you for joining us for this episode of the Paw Report. We'll see you next time.
Okaw Vet Clinic in Tuscola and Dr. Sally Foote remind you to properly take care of your pets and are happy to help support the Paw Report on WEIU. Okaw Vet Clinic located at 140 West Sale Street in downtown Tuscola. More information available at okawvetclinic.com.
Dave's Decorating Center is a proud supporter of the Paw Report on WEIU. Dave's Decorating Center features the Mohawk Smart Strand Silk Forever Clean Carpet. Dave's Decorating Center, authorized Mohawk Color Center in Charleston.